Hi everyone, my name's Jolie. My summer project was a literature review about health insurance and maternal mortality in the United States. We decided to do this topic because the maternal mortality rate in the US is the highest amongst developed countries. There's been more policy attention specifically related to insurance about this, so we wanted to kind of synthesize what empirical evidence was out there combining these two topics. So we went about performing a scoping literature review of multiple databases using keywords that were specifically related to both maternal mortality and insurance, and ultimately had 17 full text articles that were included in the review. These articles were still pretty heterogeneous in what data they were using and how they were looking at mortality. The biggest divide was between studies that use state aggregate data to look at the effects of specific policies versus studies that used individual mortality and were looking at lots of factors kind of within that or in different ways. Some studies were looking at particular causes of mortality, others were more regional reviews. But amongst the studies, there also was variation in the timing that was involved. So some were only looking at in-hospital mortality, others was looking at postpartum mortality up to 6 months to a year. But all in all, the state studies kind of showed a positive effect of expanded insurance access and a decrease in maternal mortality. So for example, some states that expanded Medicaid typically had a leveling off of maternal mortality rates since they did so, versus states that opted not to expand Medicaid in the Affordable Care Act have continued to have an increase in maternal mortality in their states. Within the individual data studies, there were 2 case control studies that showed a not statistically significant effect of insurance, but otherwise the studies in this group showed varying degrees of a beneficial effect of insurance and a reduction in maternal mortality, which is really promising. Some themes that kind of came out through those as well was that private insurance typically is more protective than Medicaid. This also is probably very multifactorial, but some proposed reasons are some like care gaps or differences in population amongst those other differences in population of those groups. Additionally, the effect size varied significantly by racial group, both within the state and individual data. So overall, despite the fact that there's a lot of commentary and kind of think pieces about the importance of insurance, the empirical data is limited, but the state level research is really promising, and further research at the individual level would help sort of tease out the mechanism of effect and better streamline further health policy development and be able to figure out how we can better improve maternal health in this country and better protect future mothers. Yeah, that's all in all. Our main finding was that we hope more research could be done on this topic, and that we can keep working to address this in the US. Thanks so much for listening.